Okay, Sherry, so tell me when you took the training and where you've gone with it. What have you done with the work?
I took the training back in 2005, it's been almost 8 years, I guess. And although I haven't done a significant amount of prenatal massage, I do use the coursework with probably 30 or 40% of my clients. I certainly use sidelining, in a significant number of my cases because I do a lot of hip, low back, as well as rib cage work. I've had a few specific clients, especially with the elderly. I had one client who was 89, and I worked with her every week sidelining. She had been through a hip fracture, and the only way she could be positioned on the table was comfortable with cushions. I also had one client with COPD, and she had a lot of breathing problems, and so we did a lot of rib cage opening work. But with a majority of my clients, even if it's just for 5 or 10 minutes during a session, I will oftentimes, do prone, supine, and then if they have a right or left hip issue, I'll often throw them on their side to do some of Carol's work, some deep tissue work to the hips. And one benefit of doing it with other clients rather than just prenatal is that you can go a little bit deeper, do a little bit more stretching. We talked about the relaxin, and so with clients that you don't have to worry about those range of motion issues, you can actually take them a little further with the same work. So I've just found really positive results using the same techniques with all of my clients.
Great, great.
That's kind of and I'm back in her coursework because I love her as a teacher. She's just so wonderful at explaining things, diagramming things, and just answering our questions. And so she's just a great educator to learn from, but also just another tool in my toolbox of massage therapy tools.
Great. Thanks, Sherry.
You're welcome.
Ta-da.